Good afternoon. My name is Corina Herrera Loera, Public Information Officer here for the Emergency Operations Center for our County of Santa Clara. Today we have Ricardo Romero Morales, and we have another guest speaker joining us shortly. But we're going to go ahead and start with Ricardo to tell us a little bit about Binational Health Week and what it is, how it started. So, Ricardo, thank you for joining us. I understand you're the Binational Health Week coordinator for our county. If you can tell us what Binational Health Week is about, how it started, and how it became a month now. Welcome.
Thank you so much, Corina. And you're right. So, Binational Health Week is now entire month. So, Binational Health Week started in 2001. And since then, we continue to grow. So, this year, at an international level, we're celebrating the 21st anniversary of Binational Health Week. And here in Santa Clara County this year, we're celebrating 17 years of Binational Health Week. So, what Binational Health Week is an initiative in where community partners, volunteers, and governmental agencies come together to provide services to our community, more particularly to the Latinx community that live here in Santa Clara County or in other parts of the United States. Now, Binational Health Week does not only happen here in Santa Clara County; it actually happens all across the United States, Canada, and some parts of Europe. So it is more of a collaboration between the Mexican government, some of the government from Guatemala and Central America, as well as South America. So it is pretty much an initiative in where we're trying to bring resources, health screening, and easy access to all these services to our community.
Thank you so much, Ricardo. And we know the importance of keeping our residents healthy, and I understand that you have many events coming up. You just had one. If you can tell us how that went and maybe any upcoming events that you have.
Yeah. And also let me expand a little bit more about Binational Health Week. Sometimes our community members may be a little bit afraid of talking about or seeking services. There may be a language barrier. There may be other reasons, such as immigration status, that they might not seek in medical services. During Binational Health Week, what we do as an initiative is to bring the services that our community agencies offer here locally in Santa Clara County to where our community is. So in this case, this past weekend, we had an event over in Eastside San Jose at the Blanca Alvarado Resource Center, in where we did pretty much a whole health fair, in where we had Flavio Lacayo from Telemundo 48, who was our MC, as well as we had supervisors from the Board of Supervisors here in Santa Clara County, and some of the city council members from the city of San Jose. And what we do during this event is we provide health screening services. This time around, we were able to provide HIV testing, flu shots, COVID-19 vaccines, including boosters, as well as flu shots and glucose screening. So we provide all these services to our community for free at not cost at all. Yeah, they don't need an insurance. They don't need a social security number to receive these services. We also provide educational materials in their language, whether that is English, Spanish, Vietnamese, Chinese, or Tagalog, as well as any other resources that we may have. This past event, we actually had over 300 people who attended, and we were able to give away more than 100 different gifts to our community, including bicycles, blenders, and a lot of other goodies. We also had a partnership with Telemundo, and where they were able to get us some tickets to Earthquakes games. So some of our community members will be attending some of the Earthquakes games here in San Jose.
Great. Well, thank you so much, Ricardo. And I know that you've created a great partnership with our consulate, Mexican consulate. And so we have our guest here, Alejandra Bologna, which I'm going to welcome in. Welcome, Alejandra Bologna, our Mexican consulate of our city of San Jose.
Thank you so much for the invitation. I'm really pleased to be in this program.
Great. Thank you so much. And I have some questions for you. As I mentioned, I know Ricardo's been doing a great job, from the county and the consulate, having a great partnership on behalf, especially of our Binational Health Week. Can you tell us a little bit about the importance of this celebration, the Binational Health Week, in our community, specifically our Latino community?
Of course, well, we have it's more or less 17 years, if I don't have a mistake, but we have a strong alliance in one issue that is very important for us is to bring to our community a lot of information regarding health. Uh, Health is a treasure for all of us. And without health, they can work and they can get all their goals that make them came here. So what we do is to have different information and tests so they can have all this information and have access to different centers. It doesn't matter if what is their migration status. What is important is to have health prevention and also the resources that, in this case, the county has to give them the opportunity to take care of their health. And we have been working a lot during the COVID period. And now that we are going back to normality, we will have different events at the consulate and also online.
Great, thank you. And I know that you mentioned COVID-19, and you are all providing, the programs and special even supporting, our community with where to get access to different things, whether it's the vaccine or the tests and things like that. In regards to the Binational Health Week, and even the other things that you did during COVID-19, we all had to adapt. And so, can you tell us how the Mexican consulate staff adapted during this time?
Well, it was the beginning. We follow up always the recommendations and the dispositions of the Santa Clara County, where it is placed the consulate. And at the beginning, it was about a month that we just serve essential needs of our community. We start reopening as slowly as a normal then activity since I think it was more or less middle of May of 2020. But what was hard is to prepare the whole consulate to that period when we start using um, more documents daily to our community. So, the acrylics to have the safe distance and taking care about masks for everyone and also for people that was coming and all what was need, the spaces between any window of attention and also for seating. All we are fortunate that we have enough space, so we always keep distance. We always keep the number of people that at the same time could be inside an office. And as you know, we are, in one sense, we are essentials because there is no other place where people could get the documents they need, also for getting the vaccines, or at the beginning for being tested, or for getting a check for payment, opening accounts, or getting their driver license. So what we do is to serve them in essential issues like the passport and matricula consular. Also, if unfortunately some lose of their lovely ones, that we help them to send back their souls or bodies of their families or parents, and also giving all the documentation that they needed for the return of the bodies. And also, it was a challenge because you need to keep safe everyone personnel inside the consulate, that they were really amazing how they were working to serve our community, and at the same time serving a community with a lot of needs, but that you need to limit the number of people at the same time or daily that you can attend. So it was really interesting, but fortunately we worked hard and we could serve our community since more or less May 2020.
Oh, that's great. Thank you. And I wanted to bring us back to October of last year. Everything looked different for all of us, right? In the year of 2020, and even up to now for some of us. And I know that Binational Health Week is a big week also for the Mexican consulate, just like our county here in Santa Clara. What kind of events did you do? What kind of shifts? What did October look like in 2020 when Binational Health Week? What did our community see during that time?
Well, we were focused most of the week, but more than a week, it was almost a month, we were focused on COVID. 19, no, because it was first of all in different issues, the tests. So all of them can test, giving a lot of information what they need to do if they have a special need because they get ill, or some of their family members of some of the people that, because sometimes there are two families living in the same place. So all kind of information, we connect them with the different resources that the county has to relieve the situation of all these vulnerabilities of our community. As you can see with the statistics, the Latino community was the most hit by the COVID. So that's why we focus our Health Week on all COVID, but at the same time, in other illness like heart disease and diabetes, because those are also problems for our community, and it is important to have this prevention, to give them the most information to prevent that they will arrive at a situation that could complicate their health. So in this year, what we are going to do is a lot of events, but we are going to start also with the possibility of having vaccines for COVID-19.
That's great.
Thanks of the all the contribution and help of the county, so we could have also in different periods the different the shots for the COVID
Thank
vaccines.
you. No, that's great. And I just want to remind our audience, our community who's tuning in, that you can jot down any questions that you have for the Mexican consulate, Alejandra Bologna, or Ricardo Romero Morales, who's our coordinator for Binational Health Week here. So if you have any questions, well, go ahead and jot them down. I'm going to take some time at the end to help facilitate some of those questions and answers, the portion of our segment here. And Alejandra, I know we're talking about health and the importance of keeping our community healthy. And I know the Mexican consulate's here to support our, community, and especially our Mexican community that's here in the county of Santa Clara. Can you tell us a little bit about your health window? I believe you all have a health window there at the Mexican consulate, and what kind of services somebody that comes to the window, what can they receive?
Of course, we have here permanently health window. We can say it like that. We work with community partnership. We have an alliance, so community health partnership. They are our partners to run the Ventanilla de Salud, and it's really important because it's a mechanism where our people that if they have appointment or not, they just can come to the window, or they can access and have the information they need if they want. For example, known about some insurances, community health organizations where they can go and have some tests if they have special concern about nutrition, for example. So it's a window that daily gives information for the people that is coming to get their documents at the consulate, but at the same time with some orientation. For example, at the beginning of when the vaccines were starting, to be applied, and there were certain ages or groups of people that were going to get the vaccine. Through the Ventanilla de Salud, a lot of people that was afraid of going, or maybe they didn't knew, or they afraid that giving information that could damage their status or whatever they thought, the Ventanilla Salud was very helpful to register them and send them to the places where the vaccines were able to apply them. So it's a permanent place where our community could get direct information regarding their health.
Thank you. And just want to remind our audience, we are here to talk about Binational Health Week today. I do see some questions. We do have our general community forum to talk about any COVID-related cases upcoming on Wednesdays. So know that today we're here to ask our Mexican consulate and our coordinator for the Binational Health Week, Ricardo Romero, any questions regarding Binational Health Week. But yes, thank you for tuning in. And Alejandra, I understand that you have several resources and services for our community, and you went through many of them. I just want to, if you don't mind highlighting again the different resources and services, because when somebody hears about the Mexican consulate, I don't think people, some people that maybe some of us have gone to get services for our family members and ourselves, maybe we know, but maybe somebody who has not gone that might need some of those resources and services. If you can again tell us what kind of resources and services can somebody who's eligible, what can they go and get? I know you mentioned, even support with, funeral services, resources. I know license plates, things like that. What are some of the things that somebody can go to the Mexican consulate, and what are some of the services they can get?
Yes, of course. Sometimes people think that at the consulate they just receive a passport or a matricula consular. But also it's a place where they can get, or we have different activities. We have this health window, but we have also an education window and a financial window. The education window is focused on giving information regarding the education for parents, and also how to help their kids, their children, how to be involved more in the educational system and help them to go to college or to universities. So it's education orientation that it's really important. We have a lot of people that comes back and forth from Mexico and the United States. So also through the Ventanilla de Educación, they get information, they get the revalidation of their grades, so they can just, if they were, for example, in fifth grade, then just certificate their information they have, and they start fifth grade here in the US. And it's the same if they were here at school in fifth grade and they're going back to Mexico through this documento de transferencia. It's a transfer document of grades. Then they could start school at the same level where they were here in the United States. So and also we gave a lot of information about what do you need to go to college, how you can, that it's not necessary have a lot of money to go to university, how you can save and how you can have access to different programs that are really a low cost. And much of all is the importance how to get the goals for achieving the possibility of going to college. So there's a lot of also in the financial window. What we do is to give some skills to our community, like entrepreneurship, basic information, also for paying taxes, what they need to do, or also if they want to open an account, or if they want to send back money to Mexico, all kind of information, so they will have a lot of opportunities and possibilities of getting the best ways to, for example, send in Mexico or opening accounts or another financial instrument. And we also have different areas as the cultural area to promote cultural ties with Mexico and California. And we have also an important economic and cooperation area here at the consulate. And we also follow the interaction with local authorities. So that's more or less what is the activities of a consulate in a certain place. And we serve to the jurisdiction or to the people that it's in the 4 counties that we serve. That in this case is Santa Clara, San Benito, Santa Cruz, and Monterey counties.
Great. Wow. Thank you so much. That's a lot of things that the Mexican consulate does. I'm going to go over to a question that I see from Carmen Castillo. And before I go there, I want you to think a little bit about, any messages to our community in regards to COVID, in regards to the vaccine. I'm sure that the consulate has seen many stories, many families impacted, by the COVID, COVID-19, and, how some of those things could have been prevented. But I think most importantly, any message that you have regarding the vaccine. And so after we go to Carmen's question, then we'll go to your message about the vaccine against the COVID. So let's see, we have Carmen Castillo here who's asking, is your health window open every day?
Yes, well, they have, yes, you can access by phone daily, but also we have present people that came 3 times of the week.
Great. And can you tell us the phone number that it can be accessed?
Yes, of course. It's 408-856-2840. And then
2840? Sorry.
40, yes.
Okay.
And then immediately you have the access to the health. It's the different departments that we have, and they got the health department.
Great. So on the screen, you all see the 408-856-2840, and that's the number to the health screening desk. And is that Consulada Mexicana? Is this also the number directly to the consulate or just the health screening window?
It's a consulate, and it's a central phone number, and then you can achieve the different departments that we have at the consulate.
Perfect. So,
and you can also get the community department, and you will get information extension 131.
Great. Okay. So extension 131, the number again, 408-856-2840 for the Mexican consulate. Thank you so much. And now, if you can give us, if you have any thoughts around the vaccine for our community, any thoughts about should they get it? Should they not?
We recommend that we almost all people here at the consulate got the vaccine. I think that if any people has a concern about the effects of the vaccine, please talk to a doctor, not just read what the social net says. It's important to be well informed, because it's a way to, if you still get the virus, the COVID, the effects having already the vaccine will be very small than if you don't have any protection. It's a way, and there's a lot of people that already have the vaccine. It has demonstrated that is a way to protect yourself against this virus that has been really harmful for people. No, the number of people that has been died, the fast way that spread it, And considering the different conditions that a lot of Latino has, like diabetes or blood pressure or other kind of illness, so they worse if they don't have a vaccine, they don't have any protection, and could complicate their health if they don't get the vaccine. So it's something that all doctors and we also recommend. And if they have any problem to access to a place for getting the vaccines, they can call us at the consulate, can call the health window to have the information and to get registered and to have access to the vaccine. We know that almost Santa Clara is one of the number one counties that more population has access or got their vaccine. But at the same time, the Latino community is under those statistics. So if it's like 80% of the whole population that are already eligible for getting the vaccines. In the case of Latinos, it's more or less 70%. And Ricardo, I'm sure that has these statistics better than myself. But that shows that still is some work that we need to do to protect our community because they are essential workers. They are more exposed to the virus. And because of their condition, also, you see that it's not just one family, there are one or two families living in the same house, so they are more exposed to the virus.
Thank you. And I don't see any other questions in regards to the Binational Health Week. Ricardo, I know you've been sitting patiently, and Alejandra mentioned, a few stats or even updates that you might want to give, or any, announcements for Binational Health Week that you might have for our community. And then we can go to closing if there's no other questions that come in. Welcome back. And you're on mute. That's our typical statement, right? In these virtual days. Welcome back.
Thank you, Corina. And that's right. So, as the consul was mentioning, it is important for our community to get vaccinated. Up to this date, for the people that are eligible to get vaccinated, in terms of 12 and older, we have about 73% of our Latinx population who are vaccinated here in Santa Clara County. Now, as we recently made an announcement yesterday, we need to make sure that we are at about 80% for the entire population to be able to meet one of the three metrics that we're looking into in order to lift the mandate about masking indoor. So what that means is that we need to make sure that once we start including the population zero and above, to make sure that our community continues to get vaccinated. We don't have enough people who are vaccinated at this point, and we want to make sure that we're encouraging those who haven't been vaccinated to get vaccinated as soon as possible. We know that winter is here, but winter is coming, and so we want to make sure that we continue to talk to our community, to our friends, to our families, to our tios, to our tias, uncles, vecinas, neighbors about getting vaccinated. As the consul was mentioning, there are many questions out there and hesitancy about the vaccine, and it is important that people are well informed. And one of the ways to do this is to check in with their doctors, or they could also go to one of the websites like the CDC or the Public Health Department website. Throughout the entire month of October, we have been creating and developing and planning different events, community health fairs, in where we are either providing free COVID-19 vaccines or we are helping people sign up for an appointment. At this point, now that Pfizer booster is it's being disseminated here in Santa Clara County, we want to encourage those who are 18 and over and who received their second dose of Pfizer at least 6 months ago to consider getting the booster. The booster is just another dose of the vaccine, Pfizer vaccine at this point, that will help them bring their immune system to be to a level where people can actually continue to be protected as the exact same way that they were as soon as they got vaccinated 6 months ago or more. Now, as always, vaccines continue to be free, regardless of immigration status and whether or not they have insurance or not. And in terms of Binational Health Week events, we have our website, which is sccbhw.org, in where people can go and look at our calendar of events. We have multiple events happening in the next upcoming weeks. As a matter of fact, we have an event happening this Saturday at the Children's Discovery Museum, in where we're going to be giving out pumpkins to our community members. We'll have resource tables there from other community partners, in where people can learn more information about local organizations as well. And it is just a good way to continue to go back to or create and develop our new normal with COVID circulating in our community. We're making sure that we're wearing our masks, making sure that we're getting vaccinated. And nowadays, if we qualify for those booster shots, to get the boosters as soon as possible.
Thank you so much, Ricardo. And thank you so much, Consul from Mexico, Alejandra Bologna. Any closing thoughts, any closing comments? Thank you for joining us today and sharing a little bit more about what the Mexican consulate does in our county here in Santa Clara.
No, thank you for the invitation. And what we always, what I always request to our community is to have the self-confidence to come to the consulate anytime, anything they need. We have also the protection department, the legal department, that is very important, and that they don't need any appointment for coming and get all the information they will need. Much more if they are in a vulnerability situation. We are here to serve our community, and we are more than pleased to do that.
And Corina, before we go, I just a thought that came to my head right now. As we were talking about vaccines, I know in our community there might be questions about, well, I already got COVID maybe 6 months ago or so long ago that I don't need to get vaccinated, and how or why do I need to get vaccinated? And it is important, especially for our Latinx community, to know, and to the entire community as a whole, as a matter of fact, is that people who already had COVID, they still run the chances of continuing to get COVID again. As we know, we have multiple variants that are circulating in our community. So far, we have had the Delta variant that has been more contagious than previous variants, that could definitely infect somebody who has been infected with COVID in the past. As a matter of fact, people who have been vaccinated have also been contracted COVID in recent months. And that's one of the reasons that we're trying to highlight the need for people to get this booster shots, because perhaps those antibodies are now decreasing as time goes by. And we want to make sure that they have the full protection and the full level of antibodies that they need to fight the virus.
Thank you, Ricardo. And just to remind our community, today we were here to focus mainly around the Binational Health Week. We do have our every other week community forum coming up next Wednesday, where we will be having a doctor, and we will be focusing on just COVID-19 and the booster shots, the vaccines, any questions that you might have specifically for our doctor. So tune in. And then also want to let our community know, I know a lot of us, for example, myself, my parents are monolingual Spanish speaking. So if you have family members, tios, tias, who might want to, have a conversation with La Consul, have any questions for her, we will be on at 3:30 in our Spanish Facebook Live. And so you can tune in and, have your families tune in as well, who might be Spanish speaking and might prefer to communicate in that language. La Consul Mexicana here, Alejandra Bologna, she will be on in Spanish, and Ricardo will also join us at 3:30. So with that, thank you both, Ricardo and Alejandra, for being here with us. We look forward to continuing to collaborate and do what we can on behalf of our community to ensure that we're, safe and healthy and thriving, even during some of these tough times. Thank you so much.
Thank you.
Have a good evening.